Good day, grade 10 students. This will be your lesson for your health component, planning for healthcare career. This final year in your junior high school studies is an appropriate time for you to think and reflect about future careers. Thinking about career that will help you to decide on the academic track that you will pursue in your senior high school. The question is, what do you know about health career? Do you have a family member, relatives, or even friends who have career in health? Choosing a career is a difficult thing to do, but you need to discover what career suits your interests, passion, and goals. Before you look for a job, you have to set an achievable goals to know what you really want to be doing with your career path. There are different healthcare professions that you might like to consider getting into a healthcare profession. Nowadays, there's a health demand of workers in healthcare profession here and abroad. It offers good salary, incentives, and even job security. So in these lessons, you will be able to learn about preparing or how to prepare a personal health career following prescribed components and steps. A career is the job or occupation that requires special training. When we say career, it also includes the education, training, and even your work experiences. But when we say health careers, it is a design to familiarize students with the various careers when it comes to healthcare profession and allied health services. Health career requires these different skills and even your personality traits. Most roles require interpersonal and communication skills, technical or even the mathematic capacity and a strong work ethic. When we say health career plan, it is an individual action or initiative in making career choice, in growing in chosen career or in making a career shift which involves a very important discernment. When we say health career planning, it provides a sense of purpose and direction. Instead of bouncing aimlessly from the job to job, you will know exactly where you're heading. A career plan, it takes into an account your interests, aptitudes, skills, values, goals, and even your priorities. Now, the question is, why do you pursue a health career? So, in your own opinion, or maybe think, why do you need or why do you want to pursue a health career? There are several reasons. It could be your personal reason. We have here is a number one is competitive earning potential or money. There are some health career that has a big salary or income. Also, job growth and stability. Of course, if it's in demand, helps in improving the health of an individual. Aside from earning a big salary, you're also helping other people who are in need. And lastly, of course, ang gusto ng lahat is to travel. Okay? Travel around the world, it could be a solo travel or with a family. That's why these are the things or these are the reasons or the possible reasons that could be the answer why people or maybe you as a student want to pursue a health career. What are the components and steps when it comes to making a health career plan? You need to know these steps. We have 4 steps. Number 1 is self-discovery. Number 2 is career exploration. Number 3 is career fit. And the 4th one is the goal setting. So when we say self-discovery, it is a career plan that begins with self-exploration when it comes to deciding what is the most important to you or into your life. Job satisfaction comes from doing a job that fits to your personal interests and even to your unique skill set. That conducts a personal inventory of your interests, talents, skills, and your career values. When we say career exploration, think of careers or profession that has interest to you. Try to ask yourself what do you like the most about the jobs. You can speak with your family members, friends, neighbors, or even your teachers who know something about the career that you want. If you have time, or you can take some research on these websites, career fairs, or even the alumni connections, which describes various careers, so that you can have some ideas, or so that in the end you can decide what career that you want to pursue. Okay? Third one, we have the career fit. When we say career fit, it match your interests, talents, skills, and values with the careers that interest to you. People who are happy in a particular occupation share similar skills, aptitudes, interests, likes, and dislikes. Okay, it means you are fit in the particular career that you want to be. Okay, and of course, the fourth one, we have the goal setting. Goal setting, it identifies the goals that you will enable for you to develop your skills related to your ideal job. Your career plan is to work in progress that you will adopt and revise over time. That means you have a goal. You are developing yourself on that specific career, or you have a goal setting to be improve your own self. Okay. Here we are in the types of health careers. Now let us identify what are these health careers. We have 5 groups, or maybe these are the 5 categories. Number 1, we have the therapeutic services or the direct patient care, or as we consider, these are the hands-on patient care. It means that these are the medical specialist attendees to the patients like nurses, nursing care providers, physical therapies, and even the dentist. Ibig sabihin, these are the careers that you are hands-on. You are physically touching the patient or the people. Okay? Second, we have the imaging diagnostics. Imaging and diagnostics that involves the use of technology in the diagnosis of patients. Or in short, these are the medical laboratory technologies, ultrasound and x-ray technicians, and even your radiologists. Okay? These are the career that uses the technology. Okay? The third one, we have the support services. Support services, these are the responsible for keeping a clean and sanitary hospital or therapeutic environment. For example, is the hospital maintenance engineers and technicians, and even the environmental facility managers. So these are the services, or these are the career that make the environment clean and sanitary. Okay? And the fourth one, we have the health informatics and business. This includes the documentation services, medical record management, hospital unit coordination, hospital information, and communication systems. Or in short, these are the health information coders. These are the data analysts, healthcare administrators, or these are the medical billers, and even the public health educators. Why is there a public health educators? Because they are sharing health information, okay, about a record, about information of the bills or hospitals or a management, or in short, it is a documentation. Okay, these are the careers that spreading or sharing the health information. Okay, and the fifth one, we have the research and development. Research and development contributes to the advancement of healthcare through science and technology. In short, these are the chemists. These are the biomedical chemists, toxicologists, pharmaceutical scientists, or even the biomedical engineers. Okay? These are the careers that uses science and technology. Okay? So these are the types of health careers. These are the 5. We have the therapeutic services, imaging diagnostic services, okay, support, health information and business, and of course the research and development. Next, we have the health career pathways, or these are the cluster of occupations that are grouped because of shared skills. All these pathways have a variety of occupations that have different level of education, skill, and training. Selecting a pathway will provide you with an area of focus and a wide array of ideas for your personal development. Okay? These are the occupations under the pathways. There are maybe midwifery, health workers, community health workers, dentist, caregiver, research, and even education. Okay? Now, in health career pathways, we have 12 various health career pathways. First one, we have the disease prevention and control, or the public health. Okay? Public health, people who specialize in this area focus on communicable and non-communicable diseases. When we say public health, it addresses health concerns of communities at risk for disease and injuries. Okay? We have 3 primary tasks when it comes to public health. Number 1 is to assess and monitor the health of communities. which means this is to identify the health problems of a group of people who are at risk in a community. Okay? Second, we have the formulate public policies. Those who are in public health work with community and government leaders in drafting policies that will help solve health problems. Okay? And the third one, we have the assure that populations have access to appropriate and cost-effective care, or which means this is done by means of providing services that are related to health promotion and disease prevention. Okay? In the first one, you are assessing, you are identifying health problems. After identifying, you need to formulate, okay? You need to make some policies, drafting policies, how to solve the problem, okay? And of course, the third one, you need to assure. It means you have a prevention on the disease, okay? Or on the people who have health problems. So these are the primary tasks when it comes to public health. What are the career opportunities that is related to public health? We have here a public health practices, health education, epidemiology, environment health, international health, of course, of the maternal and child health, nutrition, and of course the health services administration. So those are the other careers that can be related to public health. Okay? Second, we have the personal health care. When we say personal health care, these are the professionals in this area do the healthcare related tasks in the personal care level. Okay? These are the services that include companionship and assistance to people who are in need to remain safe and who are need to engage in a day-to-day activities. Also, consider non-medical or even the private duty caregivers are in demand, especially to the elderly who may need companions. So those the caregivers, those are under the personal health care. It means they need a private duty personnel. Okay, so that is the personal health care. Third one, we have the maternal and child care. Maternal or the maternal health is concerned with the health of women during the pregnancy, childbirth, and the postpartum period. When we see maternal health, it also includes the other health concern that help reduces the illnesses and death of women due to childbirth. The maternal and child care, it is a pathway that health professionals deal with complex public health issues that may affect women, children, and their families. Okay? The following concern under the maternal health or child care, we have the number one is the family planning and the preconception care. Okay? It is very important to have screening or to know something or about health education, especially when it comes to family planning or when it comes also to using some contraceptive objects. Okay? Second, we have the prenatal care. And you see, prenatal care is for the early detection of any potential complication of pregnancy. That's why when it comes to pregnant women, it's very not too fragile, but you need to monitor time to time to know to detect an early detection for if there are maybe some complications on the delivery or maybe during the pregnancy. And of course, the postnatal care is the recovery from childbirth, newborn care, nutrition, and breastfeeding. Postnatal care, it means the type of care that a woman or a mother need, okay, when it comes to on how to take care of a baby or the newborn baby. Fourth one, we have the mental health care. These medical professionals specialize in dealing with interpersonal and intrapersonal relationship and life skill. Okay? When it comes to mental health care, they can be psychologists, psychiatrists, personal counselors, clinical social workers, and even other related specialists. When we see psychologists, these are the professionals who counsel people who have deep emotional problems. Okay? When we say psychiatrists, these are the medical practitioners who diagnose and treat patients who have already the mental illness. Okay? When we about the counselors, those are who assist people with problems that can be related to their mental health, or maybe there are some personal education and career decision. when it comes to deciding, okay? Mental health practitioners, or these three practitioners, or these are the professionals who are trained to help patients who have mental and emotional problems and illnesses. Number 6 is the environmental health care. When we say environmental health care, it is concerned with all the aspects of the natural and a man-made environment that may affect human health. Okay, these are the health workers try to establish the correlation between and among the physical, chemical, biological, social, and physiological, psychosocial factors in surrounding environment. These include monitoring the quality of environment and impact of human activities on the ecosystems and developing strategies for restoring ecosystems. So who are these people? Okay, these are the specialists, just like the radiation safety officer, environmental radiation officer, health physicists, water quality scientists, radioactive water specialists, etc., etc. Okay, these are the environmental specialists that they are professionals who do works related to the environment by means of research, outreach, and education, environmental cleanups, investigation, and more. Okay? So it means those are the healthcare workers that focus on the environmental healthcare, on the issues about environment. We also have community healthcare. These are the specialists in this area focus on the maintenance, protection, and improvement of the health of all community members, like the barangay community health workers or even the rural sanitary inspectors. So those are the community health care. Okay? Community healthcare workers, these are the persons who have or who help local communities receive health care from social services systems and government. Many of them come from the community they are serving. That is why they understand better the needs of the community. Especially when we talk about community health workers, they are residents on a specific or particular community. That's why they understand, they know better the needs of a community. Number 7, we have the drug prevention and control. These people who careers evolve around the area 6 to reduce community individual problems related to alcohol and drug abuse. Okay, so what are the careers related to drug prevention and control? Number 1, we have the psychiatrists and psychologists. They help people suffering from drug abuse problems and understand the root cause of their problems. Psychiatrists can also prescribe medications for the patients. Psychiatric nurses and detox specialists, they track the physical progress of patients as the medication and administered. We also have the counselors. In counselors, they are the professionals who work with teens and adults who have drug abuse problems. And last, we have the professors, researchers, and even the social workers. They are the less involved with direct care, but they try to understand the problem through the studies and research, so they can provide solutions for drug abuse related problems. Number 8 is the nutrition and dietetics career. These specialists in this area find ways to balance individuals' food and nutrition and their impact on patients' health. This includes meal planning, food preparation, and health and nutrition economics. Okay? There are two types of dietetics. We have the dietetics, we have the dietitian. What's the difference of the two? Dietetics is a study or field of study that is concerned with the relationship between the health and nutrition. Dietitians, these are the professionals who design nutrition therapies to help the body be protected against disease by means of natural food nutrients. Okay? Nutrition and dietetics career, it is a healthcare to design nutritional therapies to people who have specific health issues like hypertension, diabetes, or even obesity. Number 9, health education. Health education, those who work in this field are tasked to promotion of healthcare and training of health workers on managing change in healthcare. Their work involves assessing individual and community needs, planning and implementing and evaluating health programs, promoting the understanding of various health-related behaviors, plus coordinating health education services. When it comes to health education, this is the profession that involves educating people about health. Your health education teacher is one good example of people in this profession. That's why it's very important we have a health education in our curriculum to have idea, to have knowledge, to know the information when it comes our health. Okay, the health areas that are taught in this pathway is we're talking about the physical health, social health, environmental health, your emotional health, intellectual health, and of course your spiritual health. When it comes to health educator, a health educator is a professional who serves a health education resources person. He or she assess individual and community needs and plans, implements, of course, at the same time, administers some strategies, interventions, and programs. And of course, lastly, a health educator, he or she conducts evaluation and research. Number 10 is nursing. They are the professionals who are concerned with the attainment, maintenance, and recovery of the optimal health and quality of life of patients and communities. Nursing work also with the physicians, therapists, the patient's family, and other medical team members in treating the illnesses and improving the quality of life of the patients. Also at the same time, nursing develop a care plan for patients. Number 11, medical and allied professions. These are the career in this path are associated with safety, health, and welfare of individual engaged in work employment. Okay, these includes protecting workers from sickness, diseases, and injury arising from the possible hazards of their employment and workplace. The medical specialists and their fields of specialization under these medical and allied professions, we have the anesthesiologists about administration of anesthesia, cardiologists about the coronary artery disease or heart disease, epidemiologists about disease outbreaks, family practice physicians, a general care physician. You have the gastroenterologist, stomach, intestine, or any in your digestive system. Gynecologist, disease and condition of the age. We also have the immunologist, female reproductive system. Internist is treatment of disease in adult. Neonatologist is about nervous system. Nephrologist about the kidney disease. And neurosurgeon, of course, surgery of the brain or in our nervous system, and the obstetrician for the pregnancy, labor, and childbirth. And we also have the oncologist for the cancer or tumors, and ophthalmologist for your eyes, eye disease and treatment. Otolaryngologist is the head, neck, ears, nose, and throat. Pathologist, the study of tissues and essentials nature of disease. Pediatrician is about the childhood disease and conditions. Plastic surgeon is the use of material to build tissues. And we also have the primary care physician, general health and medical care. Psychiatrist is the mental illnesses. We also have the radiologist for the x-rays, and rheumatologist for the disease of connective tissues, joints, and muscle and tendons. And of course, the surgeon for the treats diseases by surgery or operation. And lastly, the emergency medical services or the EMS. This is sometimes known as the paramedic services or the rescue or the first aid squad. These are the people or professionals who are assigned in this work specialized in out of the hospital medical care. Their skills include the first aid procedure, emergency medical response, and even the immediate medical attention. In short, these are the health workers who are outside the hospital, like the ambulance, or these are the rescuer, paramedics, or the first aid squad. Okay? The goal of these emergency medical services are to preserve life promote recovery and prevent further injury. For example, when it comes to an accident, okay, there is a critical condition or critical life of the person, okay, you need an immediate care wherein the EMS or these services, medical services, or these are the paramedics, they will be the ones to preserve the life or recover the patient, okay, they were the ones who will prevent the severe injured person. That's why we have also include this health career pathway, the EMS or the emergency medical services.